If you've ever had any kind of a finger injury, you know how painful it is. But what about an ulnar collateral ligament tear of the thumb? Well, there's a fix for that. Dr. Megan Crosmer from Orthopaedic Specialists is here with, I guess, a kind of a newer way to treat this.
Exactly. So an ulnar collateral ligament tear of the thumb is, so a ligament is part of the tissue that connects bones together.
Okay.
So it's a fancy way of saying that the ligament that's holding this part of the bone together has torn off.
In that web that we feel right there?
Yep.
Okay, so that can happen. Well, didn't you say Drew Brees had this?
Drew Brees, 2019, he tore it, and he had actually this type of surgery done and was able to get back to playing about 6 weeks later. So
the old-fashioned way of, I guess, the former way of fixing it was some kind of something else.
Yeah, so before we used to fix it with an anchor, and so what this is showing right now actually what an ulnar collateral ligament tear is. So it's where that ligament there has torn off the bone, and so that makes it difficult. Anytime you're pinching or trying to grip something, if you don't have that ligament intact, the thumb just opens up.
Ugh,
so it can be very, very painful.
Very painful, and then it doesn't work.
Exactly.
Either, right? Okay.
Yeah, so with this newer technique, we actually drill 2 holes in the bone, and then we have this anchor that we put in, and what they're showing right now is the internal brace along with the suture. So we basically kind of anchor that in, put it into the bone, and then that's kind of showing all the different things there.
And then, so you do this, you're doing this now, and you do quite a few of them?
Yes, I do. So this is actually showing right now how we repair the ligaments. So when we put that anchor in, there's a suture that we pass back and forth through that ligament, and this is how we traditionally repaired the ligament. The additional step that we've been taking now is, if you can see that wire that kind of has, or the suture that has the zigzags on it, we actually take that and lay it over the top of the ligament. So that reinforces that ligament there. And that allows us to get people moving 4 weeks faster than we were before.
4 weeks faster.
Yeah.
You know, honestly, when I saw that you were going to come in and talk about that injury, I thought, who has that? And the guest who was just on before this segment, Cece, Kalia's mom, has that injury.
Yes, yeah.
Yes, and had it fixed the old way.
Yep.
And it's still bothering her.
Yeah, yeah.
See, and now
so she needs to come see me now.
See, and can that work if she's had a prior thing done?
Yeah, so actually we can do a reconstruction where we actually take a tendon graft from the wrist, and we still use that internal brace, so we can still get people moving 2 weeks after surgery, kind of back to normal activity at 6 weeks. And we're actually using this for other ligaments in the hand as well as other ligaments within the wrist. So it really is a game changer in terms of orthopedic surgery for us.
It's for smaller things, not like it wouldn't work on I don't know, an ankle or knee, or I don't know.
Sometimes they're using a similar thing for ligaments in that area as well. So yeah, Arthrex designed it, so they've been kind of experimenting with using it in other places. But yeah, I do hands, so I'm really well versed on that.
You're the hand specialist at OS.
But we do actually use it also in the elbow too, for ligament repairs within the elbow as well. So.
Show me your thing here. That looks like a sewing sewing kit
so this
tool.
is the anchor that we use, and this just has the internal brace loaded. So this is actually what we're using to bridge that area. So it basically just reinforces that repair so that we can get things moving, because before we had to wait while it healed. Now we can have this kind of act as a splint while we're allowing that to fully heal.
So this repair is a one and done. My thumb will be fine, and right?
Yep. Sometimes you can still have a little bit of stiffness, but the idea behind it is that we're, giving you that pinch, that grip strength back, getting you back to using your hand, because your thumb is the most important part of your hand.
I mean, think of really, when you think about it, that's how we grip everything. Is how you don't even. I mean, how would you scroll on your phone without your thumbs?
And I want to say the most important thing that I think that I wanted people to know about this is I see a lot of people that are coming in 3 to 4 months after the injury, because this is something that's often missed. So it doesn't always show up on an X-ray. So I definitely, if you've hurt your thumb, have someone that knows kind of what they're looking at, check it out, because a lot of times these are missed and we see them 3 to 4 months down the road, and it's better if we get to it earlier rather than later. Yeah,
that's a good warning, Dr. Megan. OSquastudies.com. Megan, Dr. Crosmer is the hand specialist. I mean, other docs do it too.
Yeah. Oh no, I'm the only one doing hand there.
You're the hand doc.
Yeah.
All right, that's an important thing.
Yeah.
Doctor, it's good to have you here today.
Thanks. Appreciate it.
Yeah.